Have you ever wondered what causes that itchy red rash known as chickenpox? Maybe you or a loved one is dealing with it, or you're just curious. Either way, you're in the right place. Here's a shocking fact. Before the chickenpox vaccine was introduced, nearly 4 million people in the US got chickenpox every single year. That's a lot of itchy, sleepless nights. In today's video, we'll break it all down. What causes chickenpox, the telltale signs and symptoms, how doctors diagnose it, and most importantly, the treatment options you need to know. So stick around, because by the end of this video, you'll have all the knowledge you need to tackle chickenpox head-on. What is chickenpox? Chickenpox, or varicella, is a highly contagious disease caused by the varicella-zoster virus, part of the herpes virus family. This infection primarily affects children but can occur at any age. The hallmark of chickenpox is a widespread itchy rash accompanied by flu-like symptoms. Before the introduction of the chickenpox vaccine in the mid-1990s, it was one of the most common illnesses among children worldwide. In fact, nearly every child would get chickenpox by the age of 15. Thankfully, the vaccine has significantly reduced the number of cases, but the virus is still around, so knowing the basics is key. Alright, quick check-in. Are you enjoying this so far? If yes, go ahead and smash that like button. And if you want to be part of this growing community, don't forget to hit that subscribe button and ring the bell. That way, you'll never miss out on any of the good stuff I have in store for you. Already subscribed? Comment "I'm here," and I'll give you a shout out in the next video. Now let's dive back in. Causes chickenpox spreads easily from person to person, which is why it's considered highly contagious. The virus can travel in several ways: through direct contact with an infected person, by breathing in droplets when someone coughs or sneezes, or by touching fluid from the characteristic blisters. Once exposed, it takes about 10 to 21 days for symptoms to appear. This is known as the incubation period. During this time, the virus is already multiplying in the body, even if you don't feel sick yet. Signs and symptoms. The early symptoms of chickenpox can be vague, resembling the flu. These include a fever, fatigue, loss of appetite, and sometimes a headache. But soon after, the rash begins, which is the telltale sign. The rash usually starts as small red spots, which then turn into itchy fluid-filled blisters. Over time, these blisters dry out and form scabs. This process happens in waves, meaning you'll see spots, blisters, and scabs all at once. The rash often starts on the chest, back, or face before spreading to other areas, including the arms, legs, and even inside the mouth. Other symptoms can include mild abdominal pain or irritability, especially in children. While chickenpox is usually mild, complications can occur, such as secondary skin infections or, in rare cases, pneumonia. It's important to keep an eye out for worsening symptoms. Diagnosis. Diagnosing chickenpox is usually straightforward. A healthcare provider can often tell just by looking at the rash and asking about recent exposure to someone with chickenpox. In rare cases, additional tests like blood work or a fluid sample from the blisters may be needed. This is more common for individuals at higher risk, such as pregnant women, newborns, or those with weakened immune systems. Treatment. For most people, chickenpox can be managed at home with supportive care. Rest and staying hydrated are essential. To relieve itching, cool baths with baking soda or oatmeal are helpful, and over-the-counter antihistamines can provide some relief. In more severe cases, or for individuals at high risk, doctors may prescribe antiviral medications like acyclovir. These can help shorten the duration of the illness if started early. Remember, never give aspirin to children with chickenpox, as it can cause a rare but serious condition called Ray's syndrome. Stick to acetaminophen for fever management instead. And of course, prevention is key. The chickenpox vaccine is incredibly effective at preventing severe illness and complications. For those who haven't been vaccinated, practicing good hygiene and avoiding contact with infected individuals can reduce the risk of spreading the virus. When to seek medical attention. While most cases of chickenpox are mild, you should seek medical attention if symptoms worsen. Watch for signs like persistent high fever, difficulty breathing, severe coughing, or redness and swelling around the blisters, which could indicate a secondary bacterial infection. If you or a loved one has a weakened immune system, is pregnant, or is a newborn exposed to chickenpox, it's critical to contact a healthcare provider immediately. Chickenpox might be less common today thanks to vaccines, but it's still important to understand how it spreads, what to watch for, and how to manage it effectively. Whether you're dealing with it firsthand or just expanding your knowledge, I hope this video gave you the clarity you need. With that said, thanks for watching. Don't forget to hit that like button, subscribe for more health tips, and share your thoughts or questions in the comments below. And until next time, stay informed and stay healthy.